Thank you for that, Mr. Chairman. And I know we've got a few of our former colleagues that are testifying. I'd ask Catherine Morse Rogers, who's the ranking member of the Energy and Commerce Committee, also from the state of Washington, asked if she could have a statement submitted into the record. So, Mr. Chairman, I'd ask unanimous consent if Congresswoman McMorris Rogers' statement could be into the record as well.
Without objections to order.
Thank you. I'll start with former colleague Jared Polis. Governor Polis, I appreciate you being here. And I know I've watched in your state of Colorado, you've talked about after the vaccine, how that's helped alleviate some of the health crisis in Colorado. You had said that, quote, public health officials don't get to tell people what to wear, meaning face masks. That's just not their job. I know with your state, you've gotten rid of the mask mandate, no vaccination mandate statewide. How's that worked out in your state, and continue to keep your state going and protect the health of your people?
Yeah, this is really a matter, thank you, Representative Scalise, of us having a lot more tools than we had in the early days of the pandemic. In the early days of the pandemic, there was no vaccine. There was not even widespread availability of medical grade masks. The few masks we had to be used in the hospital setting. There were not effective treatments. Later on, steroids came somewhat effective, but nothing like what we have now in terms of the monoclonal, the new drugs coming online. So it's a very different situation we were in than early 2020. And so it demands a different kind of response that employs all of the above, right? First and foremost, encouraging people to get vaccinated, all 3 doses, incredibly important. If I look down for a moment while the others were speaking, it was because a friend of mine has COVID. She's in her 70s, and I think she's only alive now because she was able to get vaccinated.
And I know my time's limited, and we've all seen people who get COVID, as you mentioned. Your friend. I know a friend who's vaccinated who got COVID. Anybody who suggests that if you get vaccinated, you're not going to get it, or only the people unvaccinated pass it on. Right. That's not science. Actually, that's misinformation. But I appreciate that. Let me go to Governor Ricketts, because Governor Ricketts, at first, for anybody to suggest that it's a political party spewing anti-vaccination information. Frankly, it was Joe Biden and Kamala Harris as candidates for president and vice president who tried to put doubt on, when Donald Trump was heading up Operation Warp Speed, on what might come out of that. But it's not a political party that owns it, even though they did that. I want to go to success rates. Look, Politico did the report. I think you cited in your open statements. They ranked every single state, all 50 states, on how they've fared through COVID. And your state came out number 1 as the best state to respond. Frankly, I think if we should be hearing from anybody about what to do, some governors shut everything down. Some governors have kept things open and mixed results. You've done both. You've kept things open and you've protected your people, all combined better than anybody. You kept your schools open, helping those kids, millions of kids across this country whose lives are being destroyed because of that. How did you do it so successfully? What could we replicate with other states who haven't done it as successfully while keeping everything open?
Yeah, I think it gets back to, I laid out that plan that we had, that 7-point plan. And it is, a lot of that plan also involves around the communication, just reaching out. As I mentioned, doing it in multiple languages, getting to different groups that were going to be more at risk, like our long-term care facilities. We had a plan from the University of Nebraska Medical Center to address that. Meat processing plants. We had weekly calls for nearly 3 months with those facilities to talk about best practices, to change the way they were doing things, to slow the spread there. We worked with our schools on what they could do, helping them all come up with plans for how they could get kids back in classrooms. I really want to credit our teachers who were double planned sometimes, right? For the kids in the classrooms and the kids who still wanted to be remote. So we really, and then of course, we looked at areas where we had folks who were going to come from a disadvantaged socioeconomic background and worked with community health centers, for example, to make sure that folks had access to the testing and the contact tracing and the PPE and vaccines when they became available. But it was a lot of communication to be able to get that message out. And then we focused on things such as, keeping our mortality rate down. According to the Kaiser Family Foundation, we're tied for the 7th lowest mortality rate of any state where people have gotten COVID, among people who've gotten COVID. We were one of the best states for kids in classrooms. We were number 6. Politico ranked us number 4 as far as kids, learning loss. We had almost no learning loss in Nebraska. And then, of course, with regard to protecting livelihoods, giving people the tools to be able to function in this new environment, giving them flexibility, whether it was waiving licensing restrictions or supervising restrictions, or providing guidance to houses of worship of how they could still have services and so forth. All those things allow people to have a more normal life. And that's what led, for example, we've got the lowest unemployment rate, not only in state history, but in the history of the United States. So it really is striking this balance among all these things that allowed us to really address this. And frankly, it gets back to Nebraskans who, when we communicated out the right thing, they did the right thing. Over 90% of our seniors are vaccinated. That's where 80% of our fatalities come from. So again, targeting the most at-risk communities is really one of the things that helped us be successful.
Thanks a lot for that, Mr. Chairman. Appreciate it. Yield back.
Thank you, Mrs. Scalise. I'll now yield